Hi there, I'm Dr. Kelly Vaughn with Restore in 24 Dental Implants, and today I'm going to answer an important question. How does smoking affect the healing process after getting dental implants? This is a great question because smoking can have a huge impact on your body's ability to heal properly, especially when it comes to dental surgery. First, let's quickly review what dental implants are. Implants are small titanium screws that go into your jawbone to act like tooth roots. Once they're placed, your bone needs to grow around the implant and fuse to it in a process called osseointegration to secure it. This healing process of osseointegration is crucial for the long-term success of your dental implant. Now here's the problem. If you smoke, it can make this healing process a lot harder, and I'll explain why. First, when you smoke, the nicotine in cigarettes causes something called vasoconstriction. That means your blood vessels are getting smaller, which reduces the amount of blood flowing to your gums and your bones. Blood carries oxygen and nutrients to your tissues, and the oxygen and nutrients are really important for the healing. Think of it like trying to water a plant with a clogged hose. If your plant doesn't get enough water, it dies. If your tissues aren't getting enough oxygen and nutrients, they can't heal properly, and that slows everything down after surgery. On top of that, smoking introduces carbon monoxide into your bloodstream. The carbon monoxide sticks to your red blood cells, taking the place of the oxygen. This means even less oxygen is available for your tissues. And without enough oxygen, the cells in your gums and bones can't grow or regenerate as quickly, which makes healing a lot slower. Another big issue is that smoking weakens your immune system. Normally, your immune system is like your body's defensive team, fighting off bacteria and keeping infections away. But when you smoke, the chemicals in the cigarettes make your white blood cells less effective, and white blood cells are what fights infection. That means your body is slower to fight off infections, which is a big risk after implant surgery. If you get an infection around the implant site, it can be painful, delay healing, and sometimes even lead to implant failure. And then there's bone healing. After a dental implant, your bone needs time to grow around the implant to keep it in place. Osseointegration is that process. Smoking interferes with this process by reducing the activity of something called osteoblasts. These cells are the ones responsible for building the new bone around the implant. It also increases the activity of osteoclasts. These are the cells that break down the bone. So basically, you've got increased activity of bone breaking down and decreased activity of bone being built back up. This imbalance makes it harder for your bone to integrate and fuse with the implant, which is essential for its long-term success. Without proper bone growth, the implant can become loose or fail altogether. Studies show that smokers have up to a 20% higher chance of implant failure than non-smokers. Another key player in this whole process is something called C-reactive protein, or CRP for short. CRP is a protein made by your liver in response to inflammation. It's kind of like a marker that tells us how much inflammation is going on in your body. When you smoke, your CRP levels go up because smoking causes chronic, low-grade inflammation all over your body. And high CRP levels aren't a good thing. When you're trying to heal, chronic inflammation makes it harder for your body to repair itself. In the case of dental implants, this means your gums and bone may stay inflamed instead of healing properly, which can increase the risk of infection and again, slow down recovery. These elevated CRP levels are also associated with a greater risk of implant failure. So not only does smoking slow down the healing process, it can also increase the likelihood that your implant won't take hold in the first place. So let's put it all together. Smoking affects the healing process in multiple ways. It reduces blood flow and oxygen supply to the tissues, making healing slower. Carbon monoxide in the blood decreases the oxygen even further, again slowing the healing process. It also weakens the immune system, making infections more likely, and it interferes with bone growth, which is essential for the implant to fuse and stay in place. It also increases inflammation and CRP levels, which prolongs recovery and raises the risk of implant failure. The bottom line, Smoking is definitely not a good idea when you're healing from a dental implant. It makes everything harder, from your body's ability to heal to the overall success of your implant. The best thing you can do for yourself and your smile is quit smoking, or at least make every attempt to cut back during the healing process. So, what can you do? Now, I know quitting smoking isn't easy, but if you're getting dental implants, quitting or at least cutting down can make a huge difference in the success of your implant. Your body will heal faster and your implant will be much better off in the long run. It's not a good idea to smoke with dental implants, but by making healthier choices, you can help your chance of implant success. So, what if you quit smoking today? What are the immediate effects after quitting smoking? Well, in about 24 to 48 hours after quitting, your body begins to remove carbon monoxide and your oxygen levels improve. This boosts blood flow, which is critical for healing after dental procedures like implants. And the impact on dental healing is improved. Improved oxygen supply increases the amount of oxygen available to the gum tissue and bone, accelerating the healing process around the implant. Smokers who quit even a few weeks before implant surgery can improve their chances of successful healing. The short-term effects, after quitting about 1 to 3 months, your blood circulation and oxygen levels normalize. Without nicotine, your blood vessels open up and are no longer constricted. This leads to better circulation. The medium-term recovery effects, 3 to 6 months after quitting, your bone healing improves. Bone regeneration, or the osteointegration around the implant, is essential for the implant's success. Smoking interferes with this process, but after quitting, bone cells, osteoblasts, function better. Those are the ones that are responsible for bone growth. You have reduced inflammation. After about 3 to 6 months, the inflammation in your gums and jawbone decreases, making it easier for your body to bond with the implant. Chronic inflammation caused by smoking can otherwise lead to implant failure. And the long-term effects, 6 months and beyond of quitting smoking, your gum health returns to normal. Your gum tissue becomes stronger, and the risk of gum disease decreases. Gum disease can cause implants to fail, so quitting helps ensure that your implants last. Long-term smokers who quit have a much lower risk of peri-implantitis, which is infection and inflammation around the implant. So if you want the best chance of success for your dental implants, stop smoking. I hope you found this video helpful, and I look forward to seeing you again soon.